is Trudy Smith, and myself and Dr. Cecil Zavira are going to talk to you about the challenges and barriers to teaching and learning for students with sensory disability. We're going to share strategies and systems that the Next Sense Institute puts into place to accommodate student engagement and learning outcomes. The premise of our presentation today is to consider the ways that we provide learning experiences for all students on the same basis. If we consider the idea of equality or the provision of the same support or teaching program for everyone, then obviously some students are going to miss out. You might also be familiar with this second image that offers the same idea. Offering the same program and the same assessment for every student does not allow them to demonstrate or achieve their potential. If we think about equity, where we provide provisions to ensure that everyone can access the program, our students have more opportunities to demonstrate and achieve their potential. But let's be honest, the reality is often quite different for some of our students. So what Sue and I are sharing with you today are considerations for teaching that ensure that any student can enrol in and successfully learn in your program, regardless of disability, without needing to bolt on a specialist provision afterwards. How can you universally design a program for your students that accommodates students with sensory disability? How do you liberate your program? Now, we've separated this program into two sections: provisions for students who are deaf and hard of hearing and those who are blind or have low vision. So let's begin with students who are deaf or hard of hearing. The first consideration is access to spoken content. How are we overcoming the hearing loss of our students? How will we provide access to what we're saying in lectures and tutorials and any audible content in videos that we share? We also need to consider the language used by students, which may be Auslan, a visual language, and how we're going to accommodate that. We need to consider how we're going to share information with our students. Participants who are deaf and hard of hearing can't read a slide while listening to the commentary simultaneously like their hearing peers. They need first time to review the slide content and then attend to the captioned and/or interpreted response. If a response is required, they then need time to design and communicate that response. So we need to be respectful of students' need to engage with each of these processes before responding. Now, you may have noticed that I pause before speaking each time I show you a new slide. I'm giving you time to read that slide. I also keep the amount of content on my slide to a minimum, the maximum of 5 dot points and short phrases for each point, which speeds up the reading process for the student. So to help me with my timing, I read the slide myself, beginning to talk about it to manage my timing. Some of our students only use Auslan to communicate and will only work in education settings where they're going to be working with students who use Auslan to communicate. So this is going to have an additional influence on the assessment activities that we develop. We ask that students engage with all lecture content. It's important for them to understand how language and communication develops, but we will make modifications to our assessments and provide additional content where appropriate. For example, when we're discussing language assessment tools, we include content about Auslan production and receptive language assessment tools. The benefit of making these adjustments is that we're modelling best practice for our teacher of the deaf students for them to take into their own professional practice. Fully accessible lectures for deaf and hard of hearing participants also includes the provision of interpreters and captions, as you can see on the slide in front of you, as well as the PowerPoint content. Now, the size of the interpreter is important. They need to be easy to follow and read. And the size and amount of the caption content on the screen at any time is also considered to ensure that that's easily accessible in the context of the size of the PowerPoint. You can see two models here of when we run tutorials. One is a straight lecture with provision of presenter, content, and interpreter. The second, on your right, is the group discussion. You need, as somebody who's running a tutorial, the ability and knowledge to turn cameras and microphones on and off, and to coach our participants on how to do this for themselves. You need all microphones off when teaching to ensure that the caption providers and audience have clear access to the spoken content. And when you're showing the video, we need to ensure that you have access, as you do right now, to my lips for lip reading, should that you need that additional support, access to the interpreter. But the interpreter also needs to be able to see the DHH participants when they're asking questions, as you can see on the right-hand side, because the interpreter then changes and voices for that participant. And so when you're running a tutorial like this, you'll have always in a group discussion, the participant who's deaf and hard of hearing and their video on. If you've got other students asking questions, you would invite them to turn their camera on so that all of the participants can see them clearly when they're asking their question. Then they turn their camera off so that provision to the interpreter is nice and clear. Be very clear about how and when you're going to take questions. Because you can't see the video of the other participants, we need to tell them how to tell us they want to ask a question, like using reactions and the hands up mechanism on Zoom to indicate that they want to talk. We need to be able to unmute them if they can't themselves to ask that question. If there's a queue for questions, you need to say the order you're taking questions. So Mary, then Paul, and then Bruce. We do this so that the deaf and hard of hearing participant won't be watching to see who has their hands up and having to watch the interpreter as well. We're encouraging them not to have to share their attention. We need to flag to them also when they can and can't jump in with a question or comment themselves, so they're aware of that cue. But it also helps the interpreter and caption provider to know who's speaking. And in the case of the interpreter, when they need to change roles and voice for the deaf participant. It is very important that the access provision is of university quality. We only use level 3 and 4 Auslan interpreters, and we've developed relationships with our interpreter providers to ensure we use the same professionals where possible. This allows the interpreters to become familiar with the vocabulary, content, and our styles of presenting, which ensures that the students receive high quality interpretation. When providing captions, we only use people to live caption for our live events. We have similar arrangements with our caption providers, so we only work with the same captioners as often as possible. We do use Rev as our post-recording caption provider, but we review every lecture before we share it with students, and there's a really good reason for that. Captions. Machine captions will result in errors, and while they can be quite amusing and entertaining, they also end up sometimes in swear words or other undesirable outcomes. And we find that the errors occur mostly with names and technical language, which is what we need our students to have access to. So while machine captions are certainly getting better, we don't rely on them to accurately transmit your live content. Now, the NDIS has made access provision more accessible for the deaf and hard of hearing community, which is fantastic. It's also increased the demand for interpreter support. So we need to book interpreters as soon as we're aware of the dates that they're needed. Similarly, caption providers prefer as much notice as possible. Now, preparation time for access providers is also an important consideration. So live events require prep materials, particularly notated PowerPoints where possible, shared with the access providers at least 5 working days prior. So they know the vocabulary and the concepts and that they can get across that. You can make changes to your presentation before the presentation. That's fine, provided the access providers have access to the main concepts and vocabulary that you're going to be using. Post recordings require time for the interpreter to view the prep materials and the recording prior to recording their interpretation, if you're bringing them in afterwards. But then finally, you need to leave time for post-production. If you run a live session with a captioner, you need to edit the video and send to the company to gain an SRT or caption file. This can take up to 5 days. Your video editor then needs to blend the video of the interpreter, plus your PowerPoint, plus you potentially, and the SRT or caption file to produce the final accessible version. There's a lot of work involved. Please time this right. I'm now going to pass the baton to my colleague, Dr. Sue Silvera, to talk about the accommodations we make for students who are blind or have low vision.
Hi there, and thanks very much for the opportunity to speak with you about students who are blind or have low vision. We work as a tertiary education provider, and so we have lots of experience with having our own students who have this form of sensory disability. It's really important that we're able to accommodate for our students' needs and also to set a best practice principle for students who don't have sensory disability but who will work in the field once they leave us. My name is Sue Silvera, and I have a clinical and educational background in blindness and low vision. And I'm hoping just in this short period of time to be able to share some pearls of wisdom with you and also to point you in the right direction for some helpful resources. There's no doubt that you could feel a little overwhelmed if you find out that you have a student joining you who has vision impairment. Vision impairment is the term that's usually used to cover diversity in vision, which includes low vision or some residual vision, and also people who are blind. Low vision is the much more common category that we see in our students. I mentioned there's diversity in vision, and certainly in the population of people who have vision impairment, there's a lot of diversity. In Australia, we're very lucky with the health service that we have access to for most people, that we don't see very many people with blindness. They certainly are in the minority in the group of people who had vision impairment. So low vision is much more common and something we should be prepared for. It's very challenging to really understand what a person can see. And on the slide now, you can see 3 different scenarios. On the left is a typical airport view. And then in the middle, this now simulates a moderate vision impairment. So you can see that loss of clarity that the person has. And then on the right-hand side, what's considered to be a significant vision impairment. And you can see a loss of form and also clarity, and how visually confusing an environment like this might be to a person. So to get prepared for supporting a student, it's really helpful if we understand what their vision is like. Of course, the best source of that information is the student themselves, and having a conversation with the student to discuss what's going to help them is a really good starting point. A lot of students will also have good reporting on their vision that you might find helpful. And if you can access their low vision functional assessment, which will comment on how they can use their vision in everyday situation, that will also be a really good piece of foundational information for you as you start to work with them. On this slide, I'm encouraging you to understand a little bit about a student's history. Some children are diagnosed very early on with vision impairment. Others will acquire it later in life. And the time when vision impairment is found to be present can be quite significant to where they are in their journey of how they adapt to their vision. So young children that are picked up with vision impairment early will often have had a lot of intervention through their life, constant good intervention to help lessen the impact of vision impairment. So we can see a little boy being encouraged to use his vision on the left and doing a fun activity like putting icing on a cupcake. And the photo on the right shows very young hands learning to read Braille. And Braille, of course, is a key tool for students with vision impairment to access literacy. So by the time these students get to university, often a lot of support has occurred, and they may know just exactly what they need to continue their education with you. It's really important when we work with students with vision impairment that we don't impose our knowledge base, and particularly things like stereotypes, on them. I mentioned that there's diversity in the type of vision impairment people can have, and there's also enormous diversity in the way people with vision impairment will choose to access their world. So here's a couple of examples. On the right, you'll probably recognize the white cane, and that's used for mobility purposes, so a person can safely navigate an environment. It's used as an identifier, so people around them realize that the person also has a vision impairment. But what you might not realize is that now technology provides people with multiple modes of access, and even something simple like an iPhone with a select group of apps can make a huge difference to a person with vision impairment for their access to their world, for their access to things like the internet and transport. So not only do we see diversity in vision impairment and the levels of vision impairment in our students, but also the way the student chooses to access. And that again will come from having a good conversation with that student to understand their access issues, despite the level of vision impairment they have, may be quite minimal. So this slide shows a young girl waiting for a train. She's using a white cane, and there are tactile markers that have helped her find a location on the platform to board the train when it comes in. She's probably also listening to some sort of audio signalling that will also indicate when the train comes and if it's the right train that she wants to get on. Here's a take-home message that I'd like you to have. Vision impairment is a disability of access. So if we overcome the barriers to access, a person with vision impairment can access their world and our world very efficiently and very meaningfully as well. Just remember that one. Vision impairment is a disability of access. This slide shows you what's called the expanded core curriculum. And it's the curriculum that is followed for students with vision impairment in Australia. And it's a key curriculum because it shows the core academics at the centre, but all those other areas that students with vision impairment will have been supported in their whole schooling. And these continue through to their tertiary education, but all of these areas have been attended to by specialist teachers and all the professionals working around that student through their education. So you can see there's really key areas. Compensatory access. How can they actually access the visual world? Sensory efficiency. If they have vision, how can they use that residual vision in an efficient way? Or there are other senses that may use, such as auditory senses. What sort of assistive technology does the person use to be able to access whatever they want to access? Orientation and mobility is key to their safe movement and travel. And of course, things like social interaction is vital for young developing students. Self-determination, being able to make choices for themselves and advocate for themselves, is critical. Of course, working towards independent living and enjoyable recreation and leisure, and considering their career education and opportunities. So our students often come to tertiary organisations very well prepared if they've been exposed to this expanded core curriculum throughout their schooling. A lot of these areas have already been attended to. Let's talk about some of the things that are critical to a student's success at university. And it's not just the academics at all. It's things like travel. How will the student be able to travel independently from home to the university? And there are great organisations like Guide Dogs Australia who will support learning how to travel independently. This is part of the pre-planning that goes on prior to the students starting at university. Gaining access to the campus in a safe and meaningful way. Again, organisations like Guide Dogs can support a student getting to know a campus. On the slide now you can see a tactile map. That's a map of the campus that the student can feel with their hand that will help orientate them to where they need to be. And here's a few things to consider when a student is trying to access their learning materials. If a student's got low vision, they may already be very efficient large print users. They might prefer a low vision device such as a simple magnifier they can use. There's lots of assistive technologies like closed circuit televisions and electronic magnifiers that they can use with efficiency. And of course there's also Braille. So students with low vision can often suffer high levels of visual fatigue, and they may use print at some times of the day but prefer Braille at others when their visual efficiency is low. And for students who are blind, there is of course assistive technology that they'll use, again CCTVs, electronic magnifiers, and screen readers. Is a very popular program used in Australia called JAWS that will read out what's on the screen for the person. And of course Braille is very useful for students who are blind. One thing that we work on a lot with students who have vision impairment is development of concepts. How do they get to understand what we're really talking about if they can't access vision in an efficient way? And we've seen a growing interest in 3D printing. And on the slide now you can see a 3D printed version of some chemical analysis that's on the right hand side. So that's the visual view on the right hand side, and on the left is a 3D printed model. So 3D printing can be a very efficient way to help a student develop a concept in their mind about something that's part of their essential learning. One thing that you can do that is really helpful for students who have vision impairment is to ensure they have access to print. The easiest version of printed material for anyone to access is a simple Word document. And you might like to look up this link, which will give you information from a group called the Round Table. And it's important that we comply with the Round Table on Information Access for people with print disability guidelines. There's lots of really good information in this guideline about producing Word documents, PowerPoints, and other electronic materials. Don't forget that if someone is blind and they're using a screen reader, we need to put a description or alt text on all our images. Otherwise, if the person doesn't have vision, if there's no alt text message there, they won't know what the image is. So that's another thing you can really do quite regularly when you're developing learning materials. Of course, it's critical that all students can access library resources, and now all libraries and their resources should be accessible, but perhaps then that's not always the case. If students with vision impairment can't access something from a library, They are usually very good at advocating for themselves and notifying the library or you as the academic that something is not accessible. If you're choosing websites, have a look and see if the website complies with Web Content Accessibility Guidelines, or WCAG, and we're into version 2. You can read more about this at the link that I've provided, where I say, are websites accessible? That's a good one to have a look at what needs to be in a website to make it accessible. So before you start working with a student who has vision impairment, find out what services does your organisation already offer. There should be inclusion and equity awareness happening on the campus and in all areas of offering of student life. There should be wellbeing services which will include disability support. Students don't always register for this help, but make it known to them and encourage them, because there's lots of opportunities there for students to get support. And also be aware that a lot of these students as young people will come with NDIS funding, National Disability Insurance funding. They may be able to spend some of that on things like orientation and mobility training, purchase of assistive technology. So you might like to have those conversations with students just in case they haven't registered with the NDIS and they're missing out on good opportunities for access.
So finally, we are thinking about universal design of all of our content so that we're not having to make changes if a student should join our program with sensory disability. Our best practice is that all lecturer welcome videos for courses in deaf and hard of hearing and blind and low vision are captioned and interpreted. All lectures and tutorials in the DHH course are captioned and interpreted. All lectures and tutorials in the blind and low vision course are audio described. And all handouts in the courses are accessible through screen readers. Please don't hesitate to contact us if you have any questions. Thank you so much for your time.